The fifth question in the opening is what I term the qualifying question. And that's a question where we're aiming to discover what past experience the caller has had with solutions that are similar to the one that they're coming to you for. So the question sounds a little bit like, have you sought professional help for this in the past? What we're after really is to understand specifically where they've gone before, and also what their experiences were in those experiences, in those visits. Now, it's very likely that the reason they're calling you is because they haven't found a solution elsewhere. And this question elicits their experiences that have happened elsewhere that clearly would not have been as positive as they would have hoped. What this does in a way is it encourages the caller to explain a little bit more about their frustrations in getting the solution that they're after, so that you can be the sort of compassionate ear, and you can also provide them with agreement and empathy with the challenges they've had so far. Now, during this answer, some patients or callers may in fact start talking about the competition. They might say things like, well, I went to your competitor and I found that they didn't treat me very well, or I found that they were not knowledgeable, or I found that they were treating me like as if I was on a conveyor belt, or they tried to oversell me. Now, you want to be really, really careful here, because it's okay for somebody who's calling you to say things about the competition that aren't necessarily positive. But it's not okay for you to do that. So you can agree with them in the sense that you can agree and you can empathize with the fact that, oh, I'm sorry this happened to you. But I would be very careful in jumping on that bandwagon. As well, throughout the entire opening, they might be tempted to say nice things about you. I would be very or your company, as the reasons for why they are contacting you. But I'd be very careful in getting into that too much. This is not the time for selling, traditionally. We're selling the whole time, but this is not the time to be promoting our services. This is the time to keep an open mind and to listen. The minute we start to promote ourselves at this stage and talk about why we're better than the competition is pretty much the minute they're going to shut their ears. Remember, what we're doing here is we're asking questions about them. We're not trying to promote ourselves at this time. What we're hoping to do is that through our actions of listening, we don't have to tell them that we're good listeners. Through our actions of being good advisors, we don't have to tell them that we're good advisors. Through our actions of being professional, we don't have to tell them that we're professional. It's actions that will speak louder for us than any kind of sales message that you might want to give them. So this is the opportunity to really listen. It's an opportunity to empathize and to explore these issues more with the patient so that they feel very, very comfortable with telling you more and more and more. If you use that information against them by almost, well, thank you for giving me that information, now I can sell you better, they're going to stop giving you that information, because they're not, they'll cotton on to the fact that you're only asking them questions just solely with the purposes of selling them. And that's not what you're doing. So this is the qualifying question, trying to understand what's happened in the past. Be careful at this stage to avoid jumping in on the bandwagon of slamming the competition. It's not what professionals do. The next question is the priorities question. And the priorities question involves understanding what specifically are the most important things to them regarding the solution that they're calling you about. And these things could involve many different things. They could involve safety, technology, the amount of experience that you offer, the expertise of the people that are working in your clinic, the results that you may offer. All of these things might be important. Price might also be important, affordability, convenience, timing, when they can come and see you, how many visits they might have to come to. All of these things are important things that they might be interested in. But what we're most interested in is the absolute must-haves. And everybody, when they're considering a potential vendor or for buying a solution, they tend to have a shopping list in their mind. My solution needs to have A, B, C, D, and E in terms of the things I must have as part of that solution. However, all of those things might not be must. Maybe A and B, like say, for example, they have to be able to feel confident in your level of safety, and they have to be confident in your level of experience. Those are the two main things that are important to them. But the other three things, like for example, your technology, the price you charge, or even the specific results that you've been able to achieve to date, might be less important to them. They might be nice to haves. So what we're trying to do here is we're dividing the things that are important to them by asking them what are your main priorities in what you're looking for in a provider. So I might even ask the question like this. What are the most important things that you're looking for in a provider in helping you solving this problem? And you can change the words if you like. Provider could be, laser eye surgeon, or it could be cosmetic surgeon or dental surgeon or whatever you wish. So what are the most important things that you must have in place before choosing a provider? As you can imagine, this is a massively important question. If we don't know what's most important to them, then how on earth can we imagine to be able to relate what we do to those things? Again, if they say things that you are particularly really good at, this isn't necessarily the time to get into that and to sell on those things. Most of the time, they probably will associate those things with you already, or they will ask questions. Answering questions is fine. Going too deeply into promoting everything that you're all about isn't so fine. Again, we're in the opening here. Closing comes later. So we are asking them to not only tell us what is nice to have, we need to first of all know what is must have. The next part of the question is really the following question is the criteria question. What we're after there is all the other things that they didn't mention in the priorities question. So, for example, we might allow them to answer the priorities question, which is what are the must-haves? And then once they're done, we might ask them the next question, which is, okay, well, apart from that, is there anything else that would be nice to have in choosing a provider like ourselves? And that gives them the opportunity to tell us more information about the things that they might not have thought of first. These will be secondary priorities, or what I call criteria. So criteria is more about the things that they would like to have, but they're not absolute musts. I think what's really, really important for you to remember is that your solution that you're offering doesn't have to be perfect. It doesn't have to be completely devoid of any weakness. In fact, every solution has a weakness. You might have a great price and great quality, but then it might take a long time to deliver on that. You might be able to deliver really fast and have great quality, but you then have to charge a really high price. You might charge a really cheap price. That might be considered as advantageous, but maybe your quality isn't so good. And maybe your convenience level in terms of when you can deliver isn't great either. So you really need to understand the fact that not every solution is perfect and not any one solution is perfect. The key thing to remember is that a solution, for it to work, doesn't have to be perfect. It just has to be better than what they're doing right now. If it's better than what they're doing right now, then it's worth investing in, whether it's time, stress, or money. That leads us to the next question. And that question relates to the influencer question. That's question 8. So question 8 is all about who else is involved in helping you make this decision. We need to know that because let's say, for example, somebody comes into an appointment. They're all excited. They deal with your technicians and your doctors. They're happy. Everything works out. They're suitable. when it comes to actually asking them to go ahead and book a treatment, they turn around and they say, sounds great, but I have to talk to my husband, or I have to talk to my wife, or my mother, or my dad, or my son, or my daughter, or my priest, or my accountant. You don't want that situation to happen, okay? You want everybody who's involved in making that decision to arrive at the appointment so that they can be there firsthand, listening to what's being said. I'll illustrate this with a very simple and probably commonplace phenomenon. You might have invited the patient in and they're really excited. They're happy to go ahead and they say to you, well, this is all very good. I know I can use it. I know I can afford it. I know that you're the right people to do it for me. But I have to go and talk to my husband. Okay, fair enough. So you say, all right, well, no problem. Go and talk to your husband and we'll follow up with you soon. So the lady then goes home and she says to her husband, guess what? I had a great appointment. They can do everything that I want. I'm really excited and we can afford it. And, I'd really like to go ahead. What do you think? Now, the husband might want everything that's great for his wife, but naturally they're going to be perhaps potentially apprehensive about what the wife is about to go through. They might have some fears. They might be a little bit protective. So they might say to the wife, well, that all sounds really good, but are you sure that this is something you want to do? Are you sure this is something you would rather put off? What about these risks? What about these side effects we keep hearing about? Are you sure this is something you want to really consider? Now, the time for asking those questions isn't after the appointment. It's at the appointment, so that the people who are qualified to answer those questions can answer them appropriately. So it would have been much better to invite that husband in with the wife to the appointment so that they could engage in it together and they would have been able to ask all the questions they had. The husband would have had his concerns assuaged. The wife would have been more confident in her decision because the husband was right there next to her, and she would have felt like, okay, we're in this together. We're happy to move forward. Let's make the decision right now and make it happen. Now you have the wife going home, talking to the husband, getting distracted. What's going to happen to that level of motivation? It's going to go down. So this is the problem with having the decision makers not present at the appointment. You really want to ask the question, who else is involved in helping you make this decision? And when they tell you, invite them to come and visit with you at the appointment. Now, you might have some patients say, oh, no one else. I make these decisions entirely on my own. Fine, no problem. If anybody asks you why you're asking, be honest. Well, I just want to make sure that everybody who's interested in helping you do this is there with you at the time, and they're, of course, welcome to come. So that's the 8th question. Now, the 9th question is sometimes confused with the 10th question because they're both timing related. But this is the deadline question. And the deadline question is all about trying to understand when does the patient or when does the prospective patient want all of this completed by? When do they want to be free and clear of the problem? When do they want all of this in the past, including not only the appointments, perhaps the treatment date, all the aftercare, it's all out of the way. That's what I call the deadline, okay? So everything has to be done before the deadline. Now, the reason I want to know this is because I want that patient to tell me very clearly what date they have in mind for all of this to be done so that I can work backwards 2 months, 3 months, 4 months, whatever it takes to make sure that it's clear that they need to make the next step now or much earlier than they imagined the deadline to be. Now, the deadline might be very, very close to that future motivating event. If that's the case, fantastic. If you've already done your work on getting that future motivating event, then they will give you a deadline that's probably very close to that. Deadlines are essential for booking elective procedures because, again, as mentioned, you can always put it off. So a deadline's great for encouraging people to be urgent about it. And they're doing their own urgency work, which is much better than you doing it. So really, effectively, what you're doing is when they tell you what the deadline is, they've effectively told you, this is when I want to have it done by. What do you think's happened? They've effectively already purchased the product in their minds. That's what you want. You want that psychological purchase to happen in their minds, at least as far as the appointment goes. Now, that's the deadline question, which is often asked by, when would you like all of this to be done by? When would you like to be free and clear of all of this so that you can start to enjoy the solution that we're offering you? The 10th question is slightly different than that, in the sense that we're not asking, it's still about time, but we're not asking about the deadline. We're asking about the next step. So if you consider the deadline being here, far away in the distance, then what we need to do is we need to think, okay, well, how long does a typical patient have to get through or have to take in order to get to the point where they're free and clear? In some cases, it might be 3 months. In some cases, it might be 12 months. In some cases, it could be 2 weeks. But whatever it is, we have to work backwards and make sure that we get the patient to have the appointment as soon as possible so that they give themselves enough time to reach that deadline. So for example, let me give you an example here. If the patient wants to go away skiing, and that's one of the reasons they want to have eye surgery. They want to go skiing. They don't want to have to wear glasses under their goggles. Who would want that? So they know they're going to go skiing in November. Well, that's their deadline. Yeah. And in fact, if they're going in November 15th, then they probably want to be free and clear November 1st, as an example. So that there's a little bit of gap and sort of wiggle room in case they can't make that date. They wouldn't want to cancel their ski trip. So November 1st is really their deadline. Now, if we work backwards and we know they have to be around for, say, 3 months after the procedure, then we can go backwards. We can think, okay, that's October 1st, and then that's September 1st, and then that's August 1st. So that means really they should have the procedure by August 1st. And if we know that there's at least a waiting list of 4 weeks to 6 weeks, then really they need to have their appointment 4 to 6 weeks before that. So that would bring us closer to June 15th. Now, if they're calling us in June 1st, that would give us a compelling reason to say, I would really recommend that you would have the appointment in the next 2 weeks. Do you see how that works? We don't have to worry about them wanting to do something well in the future because it takes a long time to get to that point. So we can encourage them to have the next step really soon. That's what we're looking for. As early as possible. What we want, especially with people who worry, especially with people who are anxious, for them to make their decision and to move ahead in as early as possible while still having conscious thought about it. Okay? We want them to consciously think about it, but we also don't want them to delay to the point where they become so anxious that they call it off altogether. And that's often the reason why people cancel, is because they've waited, they've become anxious, they call, and they cancel. And then you've got to work all over to get them back to the level of commitment that you got them right now. So really, really important to round up the opening is to finish with this deadline, with this timing question. You want to finish with timing, and it's really, really important. You can chop and change the order. If people ask you questions that are out of order, and if you kind of get into an answer that's out of order from my last 10 questions, that's fine. It happens. We can't control that. But we really want to end with this timing question. The reason will become completely apparent when we go into the next phase, which is the closing, Act 3.